Good morning, everyone, and hope my co-presenters are unmuting themselves. My name is Thomas Ray, and I represent our Wake County 4-H GIS Club. And so I am joined today by one of my co-leaders, Barbara Vedicina, and Ahan, Morgan, Jalen, and Chaitanya are club members that I hope are all able to be with us this morning. So go ahead, Ahan.
So to start this presentation, just a little bit of background information on 4-H and the Center for Black Health and Equity. The Center for Black Health and Equity is a nonprofit organization that is dedicated to addressing social, political, and economic injustices that have caused health disparities in African American communities. And 4-H, we are the largest youth development organization in the U.S., and we are specifically the GIS club in 4-H. Okay, so the way this collaboration started was the Center for Black Health and Equity wanted a map that would visually represent public health problems in counties with high African American populations. They wanted to do this because they believe that the best way to mobilize health organizations and communities to become aware of the causes is to have a good way to represent them. So as a response, us, the 4-H GIS Club, banded together to create a mapping application on the program ArcGIS using county health rankings, figured pop-ups, and symbols to represent the information for the Black population.
So the majority of our data, for example, data on life expectancy and smoking rate, was gathered from the 2020 County Health Rankings. Now, the County Health Rankings is a product of the Robert Wood Johnson Foundation and provides a snapshot of a county's health relative to other counties in the state and across the United States. Rankings are based on publicly available data and utilize in most cases the most recent data available from each respective data source. For example, we used adult smoking rates from the data set. The source for this variable is the 2017 Behavioral Risk Factor Surveillance System. Life expectancy is based on 2016 to 2018 data from the National Center for Health Statistics mortality files. Now, some sections of data, for example, stroke and heart disease, we couldn't find in the county health rankings. So we gathered those from the CDC's most recent data sets, which are from 2018. Data on hospital beds, medical insurance coverage, and poverty levels were gathered through Esri's Living Atlas or other authoritative data sources.
And so based on the request from the Center for Black Health and Equity, we identified variables that matched their research questions. And knowing that we wanted to be able to manipulate the data in the application, we decided that it may be helpful to organize our data in a meaningful way. And so we joined our other Black health data sources to the county health rankings, county level data, to create one comprehensive data set so that later we would be able to use filtering and symbolization in our web app.
Okay. The ArcGIS Web App Builder is a powerful tool that makes it easy to create user-friendly, interactive, and stylish applications to display your data. In the Web App Builder, you can customize the theme, add custom maps, configure wedges, and much more. We added wedges for filtering, printing, viewing the attributes table, and sliding to view layers. All of this in addition to viewing layers, the legend, and returning to the home extent.
So I think Chaitanya may have been having a hard time joining us, but basically to create our base map, we use the ArcGIS Vector Tile Style Editor, which allows you to customize your own base map from the ground up. There are preset styles that you can choose from to start with, as well as options to change colors, patterns, text options, and icons. And we worked with the Center for Black Health and Equity to get their brand new, because they were formerly the National African American Tobacco Prevention Network. They just rebranded as the Center for Black Health and Equity, so they had new color codes, logos, and styles. And so we got access to all of those, and we adjusted the colors of the land, water, boundaries, roads, and so forth to complement their style colors. We added their logo pattern to the background to brand it for them just a bit more.
Query filters. The filter widget is applied to the Black Health data layer. It includes 8 economic and health indicators, such as the percent of adults who smoke, the percentage of Black children in poverty, the rate of Black infant mortality, Black median household income, and so on. Filters allow the visual analysis of information included in attribute tables in one or several fields at once.
Okay, so the way that we represented data is that we used 5 layers. These layers: Black population, Black health county data, Black medium income disparities, insurance coverage, and then a layer for USA hospital beds. The easiest way would be for people to understand how the map worked was to use different shades of color to represent different health factors. For example, we used different shades of green to represent the percentage non-Hispanic Black population in each county. We chose percentage because percentage of each county better represented which counties were primarily African American versus a flat number. And then we chose life expectancy for the Black health county data because we decided that life expectancy was the best overall factor to decide how healthy a county was. So it allows you to figure out which counties that you want to click on. And if you ever click on one of the counties, it would pop up showing information such as the median household income, the rate of stroke hospitalizations, and Black infant mortality.
Okay, and now just several words about configuring Popup's menu. The application provides 5 thematic layers for which the Popup menu was configured in 2 ways. First, setting the list of attribute fields, and second, setting the display of attributes. The second method was 3 options for presenting data. In the table for the Black Health data layer, in the customized list for the USA hospital beds layer, in custom tabs and additional graphics for the 2020 USA medical insurance coverage layer. You can see examples of menu configuration on the slide. Configuring the menu made it possible to show the most significant indicators in the form, allowing to increase the efficiency of information perception.
So at this point, we see that we're, somewhere in the neighborhood of 80% done. We are going to have an iteration of this that will be is scheduled to publish on the center's webpage in January, but we know that that will not be all there is. So in the future, we're definitely going to be thinking about adding documentation links, and we're not going to be thinking about it. We're going to be adding documentation links so that end users who are going to the website will not only be able to see that visualization, but will be able to click through to find out where that source information comes from. We're also trying to see if we can't get some more granular data. We know that, for the county health rankings, for example, we've got the county level. They also do offer some metropolitan areas, but the center is really interested in understanding even down to, the more neighborhood type level in some communities. And then there are other sets of data that are only available for the state level, which having county level data would be much more helpful to kind of align that information. But then also we're thinking through creating additional filters with those other data sets. And then we want to revise the current interface. And by the way, if you go into the map and app competition gallery, you can actually look at the current version of this web app. But we do know that we'll want to do some refining so that it's easier for a public consumer end user who may not be that familiar with GIS or data in general. And so one other thing that we're going to do to kind of combat that is we do have some YouTube video expertise and artistic expertise in our club. And so some of our club members are going to work on putting together a tutorial video on how to use the application, and that will also be on the web page. And then we hope to present you an update of a more refined version next year. And so with that, I will see if I can figure out how to stop sharing the screen and see if you have any questions.
Awesome. Yeah, Thomas, you have one question. So what software was used in the analysis?
So we use ArcGIS Online. Yep.
Awesome. And did you investigate using any U.S. Census data?
Yeah, so we definitely did include some census data, and actually a lot of that census data is already in the county health rankings, so they actually bring a lot of that into what's available in ArcGIS Online. So it's really nice that, you know, within ArcGIS Online, a lot of the CDC data is there. The county health rankings data is published there every year. Esri does a really great job of curating all of that and getting it available for its users. I would say the other thing is hats off to Esri. You'll note back on the first slide that they're one of our partners that we listed, and that's because they do provide the software free for our club, as they do for any K-12 organization for educational purposes. And that includes projects that we do where our young people are learning. And so this is one of those. Any other questions? All right. Thank you.
Okay, great.